Another great question we just received. How do I decide which therapies, which therapeutic modalities, clinical modalities, are to be included in a patient's treatment plan? So a little bit of a general question, but that has a lot to do with a couple of things. A, how old is the person? The second is how advanced they are in terms of how much vision loss, what condition they have, and what other comorbidities they may have, what other disease processes are going on, and do they have any sensitivities, any allergies, anything that can't work for them. So again, we'll use things like hyperbaric oxygen, but if somebody can't clear their ears or they have claustrophobia, that's not going to be a go for them. So that's not going to be used. Sometimes we work with a lot of little kids, and little kids may not be willing to receive, rather, the needles. So we have our AcuVision Junior program that we're offer for our young kids who are diagnosed pretty early with things like optic nerve atrophy or retinitis pigmentosa, Stargardt's, Usher syndrome, so on and so forth, or even injury. So we'll figure out, depend on each case. And when patients come to the office for inpatients, usually on a Monday, I will create a treatment plan for them after talking to them, after having conversations about their condition. Again, we do a full intake. It's not just about their eyes. We want to understand systemically and holistically what's going on. And based on those findings from our intake, that will help me figure out what the best treatment plan I can come up with for you, both in office and at home going forward. So we do create both of these treatment plans. One's for patients who are in office, and one is for patients who are at home, and we often have patients who are doing both. So generally on our Eye Health Institute website, you can go and click on your condition, and we'll give general basic recommendations for you and your eye condition. Now, if you want a deeper dive in more specifics, you can either come into clinic, or we can do something like a telehealth consultation, which is about an hour. We can dive in deep and talk more specifically about your case, what's going on, so that I can have a really, really good idea in terms of what I want to recommend for your specific case. So that's pretty much it. It's actually, each case is tailored for the individual. Our base programs and our base protocols work fantastically. And if patients get results with those, awesome. If they don't, for whatever reason, there's often other things going on. If our patients are using supplements, our ACS, red light therapy, so on and so forth, and they're getting good results, we encourage them to continue. If they're doing those home therapies and they're hitting a roadblock and not seeing the results that they want, then we might need to do things like blood work or do some additional testing or do some investigation, right? And audit your system a little bit more to find out what's going on so that we can course correct and get the best possible clinical outcomes for you. Great question. Dr. Andy Rosenfarb here with AcuVision, where your vision is our mission. See you soon.